Today we are going to record an educational video where I'm going to explain how we analyze and plan the surgical procedure for a patient who is seeking an improvement in his or her nose. There are many variations in the way the nose shape is, and there are various components of the rhinoplasty that we have to do to get a result that is satisfying. We are going to record a few videos where we show the variety of cases that we face and how analysis and preoperative morphing is extremely important in making a surgical plan. The success of rhinoplasty is in the detailed analysis and planning. So I'm going to show you this lady who was kind enough to allow us to share her photograph, and she presented to me with complaint that she felt that her nose was broad. So we sat across the table and we analyzed. If you see that one important thing that is visible here is the lack of definition, or what we call as dorsal aesthetic lines, and that is what is making her nose look broad. Of course, she does have broad bony base. Her nostril base or alar base is not that wide, and looking at this, it looks like she has a fairly broad nose. Then if we look at her nose from the side, it looks like the projection at the root of the nose is not adequate. Usually it should be around 5 to 8 millimeters in front of the eye, and then we see that the projection of the tip is fairly okay for this height, but the bridge is lacking a projection here, and that could be one of the reasons why this is not looking sharp. This is confirmed on the basal view. We look at the nostrils, and the nostrils should be oblong and they should be internally inclined in this fashion. So here what we are seeing is oblong nostrils, but they are reclining. That tells me that the nose is lacking projection. Now if we did add projection to this nose, then what's going to happen in the side view? The tip is going to go forward. Then there is going to be need for building up the bridge or augmenting the nose. Then the important point in discussion is what material should we use to augment. After discussing various options, we concluded that she would be best suited to have a rib graft, and I'm going to show you how she looks after we did the augmentation with the rib. So you can see that the rib has now given her fairly sharp looking nose, and her tip is also not looking as bulbous and broad. We have of course narrowed the nasal bones as well, so they are not broad. And then when you see her from the side view, you can see that her bridge is now a little higher, nothing too much, just a subtle augmentation, and the projection has also increased, and that is enough to give her a sharp appearance and narrowed appearance. And what happens to the nostrils? You can see that the nostrils are now more vertically inclined. The base of the nose is not as broad as it used to be as before, and you can see that the increase in projection has also given it an appearance of narrowing. So all in all, our surgical plan worked, and she's a fairly happy and satisfied patient. So once again, careful analysis is the most important point in the success of rhinoplasty. If you like this video, do subscribe to this channel, and we would be happy to help you.